Hello everyone, I'm Zahra from the University of Hawaii and I will be presenting a cable-driven 3D steerable needle for improved guidance inside the tissue towards the target that can demonstrate more than 10 degrees of angular deflection inside the tissue. Generally speaking, the needle-based procedures have replaced open surgeries to perform the task with minimal invasiveness to the tissue. Surgical needles have been used in many needle-based procedures such as biopsy and brachytherapy. In brachytherapy, as shown in the first picture, needles are used to deliver radioactive seeds to irradiate the cancer at its local position, while in biopsies, which is shown down here, needles are used to take tissue samples out for diagnosis purposes. The success of these procedures depends on the precise placement of the needle tip at target position. The rigidity of the conventional needles made of stainless steel prevents the needle from bending and thereby only a straight path is achievable in needle insertion. However, in many surgical procedures, it's desired to insert the needle in a curved path to avoid puncturing a critical organ and improve the trajectory tracking and targeting accuracy. The proposed 3D steerable needle presented in our work introduces a safe movement in all directions, which is shown here in order to improve accuracy in reaching targets or in tracking a desired trajectory. In our needle design, we are using a superelastic nitinol tube as the needle's body. For 3D manipulation and improved flexibility, the nitinol tube is slotted with a series of small slits which are arranged evenly 120 degrees apart to enable bending in 3 directions. These figures are showing the schematic view of the 3D steerable active needle. 3 slits were made at the needle's distal points in direction 1, followed by 2 slits and 1 slit in directions 2 and 3 respectively. The number of slits was chosen to make similar deflection in all directions. Cable tendons were used to actuate the needle at its bending section in 3 directions. 3 bipolar stepper motors were used to pull the cable tendons to deflect the needle in 3 directions as shown here, which is called the Motorized Manipulation system. The motors are attached to a circuit board and a motor driver. The motor drivers convert a low current signal into a high current signal to run the motors. An Arduino was programmed to send command electrical signals through the circuits to move the motors at the desired angle. The cables were completely fixed on pulleys which were then tightly pressed on motor shafts. A vision-based technique was used to track the needle deflection. 2 cameras were positioned to face the needle from top and side angle. The needle deflection was then captured and measured to find the angular deflection. In our previous work, an ultrasound was used to track the needle tip in real time. However, in this work, for simplicity, the same vision-based technique was used to track the needle deflection in 3 directions in tissue. These are captured deflection of needle tip in 3 directions using the camera positions at top and side angle. The results are collected for needle deflection in air and it's showing that 11 degrees of deflection was observed. We have also inserted the needle inside the tissue-mimicking quantum and these are the collected results from there. The measurement indicates that around 10.5 degrees of needle deflection in tissue is obtained as well. Slightly smaller angular deflection around 1 degree in tissue were observed, which could be explained by a higher resistance from the tissue in comparison with in air. These plots are showing the needle shape in 3 directions in air and in tissue with 3 repetitions measured in ImageJ and in MATLAB. The purpose of this work was to show the feasibility of the design by performance assessments in tissue application in tissues. But in our future work, the needle design will be optimized by modeling the effect of the design parameters such as the number of slits, the gap between them, and the slit's height and width for any specific task at which a higher deflection is desired. Thank you.